Sierra Leone in the time of COVID-19. The impact of the pandemic on frontliners, on business, and on our community. This is The Local Response, every week with Vickie Remoe. This is The Local Response. Today I'm talking to Dr. Lisa Graham. She's a medical doctor with the Well Woman Clinic. The Well Woman Clinic is a one-stop shop for women's health in Sierra Leone. We're going to be having a conversation about the risks and challenges for pregnant women accessing care right now during the pandemic and why it's really, really important for private facilities like the Well Woman Clinic to stay open during the coronavirus pandemic. Dr. Graham, how are you doing? Thank you so much for coming on the show.
Thank you for having me.
Now, where are you from? I feel like you're from somewhere else.
Well,
where are you from? How did you get to Sierra Leone?
So my dad is Sierra Leonean,
Okay.
But I was born and raised in South Africa.
Okay.
So I went to school there, did everything there, and my parents recently moved back to Sierra Leone.
Okay.
So I was working in South Africa, and then I decided that, let me go and visit. So I visited, and I thought, there's so much I can learn. There's so much, I can do. Perhaps this is the time for me to take a break from the hustle and bustle of Johannesburg, and I moved here at the end of last year.
Okay. What is your specialization in medicine?
Okay, so I'm trained mainly in emergency medicine and aviation medicine, but I also have a special interest in women's reproductive health. When I came to Sierra Leone, Well Woman was a good fit because at Well Woman we deal with antenatal care, we deal with breast cancer, diagnosis, treatment and prevention, as well as cervical care and also general medical care. So it's a general women's health clinic, and there was a lot of opportunity for me to learn and for me to also make a little bit of a difference.
I mean, most people do know how a hospital or clinic operates,
yeah.
But just give me a brief overview of a day in the life of your facility at the Well Woman Clinic. What happens in the morning till you shut down for the day?
Okay, so we start every morning with a short staff meeting, a little prayer meeting, just to coordinate what is going to happen during the day. Right now, our clinic it opens up at 10 o'clock. So we're there from 8 o'clock to start preparing. We clean, we make sure that everything's sanitized, we put all the chairs out and make sure that our patients will be socially distanced. Mm-hmm. And when the clinic starts, our patients start from triage at the gate. Mm-hmm. So they'll come in, they'll wash their hands, they're taken into the triage area where we ask, obviously now it's COVID-19, so we have to ask questions related to any symptoms and signs, and at the beginning, even before we had any cases in Sierra Leone, we had started that. Okay. So at that time, things like travel history was really important, okay, and contacts, but now it's shifted to more looking for symptoms. Mm-hmm. And then our patients come in 3 different tiers. So on the one side, we have our pregnant women that are coming for the free antenatal care services. And on the other side, we have breast cancer patients or patients with breast lumps. So for any general breast checks, anyone who's coming up for follow-up, anyone who's already been treated, and we're just checking on them. And then the third leg is patients that are sent from other clinics for ultrasound scans. Okay, referrals. So yes. So that's essentially how it starts. They'll come in, they walk through the gate, we sanitize, they wash their hands, they are triaged, we sanitize their bags and their shoes, and then we only let a certain number of patients in to certain areas at a time. Okay. So it has been a bit difficult because you have to control the numbers. When Sierra Leone first started getting COVID-19 cases, a lot of places shut down, and we were still open, so we saw an influx of patients. Okay. And we really had to regroup and take time and say, okay, how are we going to be able to manage our patients? How are we going to be able to keep them safe, as well as keep ourselves safe? Because we're dealing with people that are immunocompromised because of pregnancy, immunocompromised because of cancer, we couldn't afford to let things to be slack about certain things because we didn't want anyone to come and catch, COVID at our clinic.
Sure. Why do you think that so many private facilities have had to close down? I mean, when you think of clinics or hospital closing in Sierra Leone, it's crazy. I know that they're used to doing this before, and during Ebola, facilities closed as well. But in a country where you have 1.4 doctors for every 10,000 people, it just seems insane that, you know, we can't manage things where these private facilities can stay open. Why do you think that they've all had to close?
I think.
Or what do you think the rationale is?
I think initially it was an influx of patients that they were not sure how they were going to be able to control. Okay. Because people were running away from government facilities. You know, they were afraid of, oh, you know, I don't want to go to this hospital because I might catch that. So they were going into private facilities. And then in private facilities, you might get 1 or 2 people who now also had COVID, because we must also remember that in private facilities, a lot of the staff are also working in public facilities. Yes. So I think there was a phase where it was like, okay, so many of our doctors and our nurses are in quarantine or self-quarantining because they've been contacts. Okay. We need to shut down, regroup, probably do a mass disinfection and come up with a strategy that will make us safe and our patients safe. I think also a lot of private facilities didn't completely close, so there's certain services that weren't available anymore, and also they might have not accepted new patients. So I know a lot of established centers were like, okay, old patients, you can come back for follow-up, but right now we're not accepting any new patients. Which is difficult. It's difficult because it's also not sustainable, because where will people go? You know, people aren't going to stop being sick.
No,
you know, pregnant women don't stop being pregnant. You know, the babies still grow. They still need to be taken care of.
When I was pregnant, I cannot tell you how many times I thought, can we just like detach this thing so I can go for a run and then like put it back on?
Yeah, no, it is quite difficult. And I think another factor that I must mention is that a lot of facilities just didn't have the adequate PPE that was needed. So they felt that, okay, we can't really protect our staff. So we need to make sure we have enough before we can open, so that we can protect our staff and our patients.
I mean, it feels like the responsible thing to do, but it also feels like, I don't know, it's just such a difficult thing. And so then you think about, I guess on my end, the first thing I'm thinking about, well, couldn't the government in some way provide guidelines and support to private health facilities to say, okay, if you guys are interested in staying open, here's how we can support you to ensure that you can send, here are the guidelines, this is what we need you to do, this is how you can protect your staff, come to us with PPE, et cetera, et cetera. But I feel like that's me, again, trying to be in another universe.
You know, not necessarily.
But like in my mind, I'm just like, yeah, well, part of our own COVID-19 planning on the national level, couldn't there have been like, okay, what will happen to our clinics and our private hospitals? How do we want to integrate them in terms of the fight against COVID? Maybe not treating COVID, but definitely you will get referrals, right? People will come from those facilities, so they have to be ready. But in a country where you don't have enough hospital beds and people generally are the way we are, with like life expectancy, et cetera, all of our issues, that clinics, private facilities have to close, and there's no, it's just like,
It's very difficult. I must say, with us, we did have a little bit of PPE stock from Ebola times. And then we also had quite a few donations that people gave us of extra things that they had. We did things like getting a tailor to make cloth masks. We had donations of cloth masks from Azealia with the Mask Up campaign, which we were able to give to our pregnant women and our cancer patients. And then because our antenatal clinic is a free clinic, it's being supported by the Ministry of Health and Sanitation.
Okay, so it's part of the government's public health.
Yes, which is also why we cannot remain closed, because we have pregnant women to be seen. So we did say to them that, you know, we're still open. If you have anything that you can give us, please do. And they did come, you know, with a package of, you know, shield masks and things that we could use. So we've been very prudent about the things that we have, and you know, even in America, the CDC, they all have guidelines on how to just make sure you have enough PPE, how you manage it. I think there were cases where there were nurses that were wearing garbage bags in the US.
Absolutely, yeah.
And you know, we saw that and we were like, oh my gosh, if that's happening in America and Italy and France,
totally.
You know, what about us?
Yeah.
So we've just had to be really, really careful about it. And one of the things that we realized is that if we were open every single day, then we are stretching resources and we might not have enough. So we started off with opening 3 times a week, so Monday, Wednesdays and Fridays, and making sure that we see all our patients on those days. And the 2 days in between has also been a bit helpful for the staff, because a lot of this is psychological.
Girl,
so you get to work and everybody is stressed, because we've seen that 10,000 people in wherever have died today, and people are panicked because, you know, at home people have elderly parents, people have children, even some of us are, you know, might have an underlying condition that we may or may not know about. You know, so people were coming in and we were, like, everyone was just stressed. So I think part of it was also just trying to make sure that, okay, we're gathered, we're here, you know, just focused, we're spiritually here, we're debriefing. How are you feeling? If you're not feeling well, if you're not feeling like you're okay today, do you need a day off? And really making sure that the mental aspect and that aspect of our staff complement is taken care of.
How has COVID impacted the already existing challenges for the provision of maternal health care in Sierra Leone? Well, specifically speaking from the perspective of your facility.
Okay, so for us, I think one of the biggest challenges with maternal health care is getting mothers to come into and getting antenatal care and having enough antenatal care visits. So with even it happened during Ebola, that during that time, people didn't go to hospital because they was too afraid. So people had conditions that, you know, were complicated, or some even died from, that weren't related to Ebola. So I think that was our biggest fear that would happen here, is that also people are afraid to go to the hospital. They're like, oh, you know, I don't want to go there and catch corona there. I don't want to be out in the streets. So I think the biggest thing is, the biggest challenge is providing a safe environment for them. The one thing that we have done also is that we're also doing telemedicine. So we have a toll-free number, that's 1080, that our patients can call if they have any concerns, if they have any issues, and we can direct them accordingly.
And are they calling? Like, what's the
They are. Well, they have been calling quite often. You know, once in a while you get like a prank call and people are calling asking you for top up or whatever. But generally people will be calling asking, you know, okay, when can I come in? This is how I'm feeling. Am I, you know, feeling enough kicks? I'm not feeling enough kicks. I've been bleeding a bit. And then we can also direct them accordingly, like, okay, this is an emergency. This is, you know, come in immediately. Let's see you. Let's treat you. And then some people also call because they have concerns and they just want to talk.
I'm just worried. Like,
you know, half of the consultation is talking to people and allaying their fears and just helping them to just work through some of the concerns they have.
How many of you at the Well Women Clinic are doing all this work? Like, so I see you in the facility. Then also I'm talking to you on the phone. Like, this was a lot of work. How many of you are there?
So there are 7 of us in total that are there full time. So we have we have 3 midwives. 2 are given to us, have been given to us by the Ministry of Health and Sanitation. And then the other 4 nurses are based on the other side, so the breast cancer side, the ultrasound side, and then myself. And then we work with a network of consultants and specialists that if we have any issues, we'll send our patients out. So 3 of us have phones and it's all the same line. So when the line rings, whoever's available to answer it, will answer it, yes.
Interesting.
Yeah. Well, we were trying to see how we can adapt our treatment to also protect our patients. So even with the cancer patients, you know, they'll use that line probably more often because we don't want them to go in and out. You know, with COVID, the 3 most important things are, number 1, social distance, well, in no particular order, but washing hands and hand hygiene and sanitizing hands, and wearing a mask when you're out of your house, and then social distancing. And social distancing doesn't only mean you sit over there and I sit over here, but it also means that if you don't have to go to town, or you don't have to go to the market, don't go. You know, if you can send someone else to go, then let them go.
Which
or if someone can deliver.
I'm even against sending people.
Yeah, no, it's true.
Because
that is true.
it gives you a false sense of security that they're the ones that go.
Yeah.
And, you know, I'm here, right?
Yeah.
But then if they're going, then
by that I mean like in terms of delivery services.
Sure.
And a lot of people are coming out with innovations that are also, you have different branches. You have the ones that are a little bit more expensive, and then you have the ones that are, you know, semi-affordable, where people are delivering vegetables and delivering
definitely
groceries, and those kind of things I think have worked in a lot of other countries, where, you know, trying to prevent the going up and down, because you drive past the market and nobody's wearing a mask.
No, I was.
Nobody is.
I actually, funnily, was in the markets at Freetown Road Markets yesterday, and the market was empty. Like inside the market, it was empty. There's no business. And I interviewed a woman who's like 59, who's been working there for 25 years.
Wow.
And she said that, you know, before COVID, she used to go, because she buys her produce from Dovecote.
Yes.
And she says before COVID, you know, I mean, they go Dovecote like every day, because you go buy, you sell, you go.
Yes.
Now she goes once, at maximum twice a week, because there's just there's no sale.
Yeah.
And none of them there were wearing masks. They have them, but they don't wear them. Yeah. And the thing about the masks is that it really is so important, but I don't think that its importance was explained enough for people to understand how it does protect you.
Yes.
So what I've seen in terms of behavior is when people want to talk, they take off their masks and they talk, which is actually counterproductive.
Exactly. Well, whatever was in the mask will fall into your mouth, you know, or jump into your mouth.
My sister. No, it is the talking that is spreading. Don't talk. Cover your face. Like, it's very simple. So I think that definitely there's a lot of communication still. But what do you think that pregnant women need to know with regards to protecting themselves during COVID? What should they do? How should they behave? What would like increase their chances of just like safe, you know, pregnancies during this pandemic?
I think the first thing that we must always emphasize with pregnant women is not to stop antenatal treatment, not to stop going for their antenatal care visits, to communicate with the clinic. Some clinics or hospitals have actually sort of organize a schedule where they don't have to come in as often. You might have one less visit, but you know, so that you're preventing them having to go up and down,
What's normal antenatal visits here? Is it once a month?
Depending on where in your pregnancy you have presented, you're supposed to have between 6 to 8 antenatal visits. For different pregnant women, based on the risk of pregnancy, the risk that their pregnancy carries, they may have to go in more than others.
And how do you know the risk that your pregnancy carries? Isn't it after you come to the doctor anyways? Like, you don't know what your risks are.
You can't decide on your risk at home. That risk is decided between you and your midwife and the doctors, and based on certain things. So if you have high blood pressure, if you've got anemia in pregnancy, if you've got malaria, if you've had, you know, a certain number of children, if this is your first child, if you're a teenage mother, which is that in Sierra Leone, that's a very high risk, you know, teenage with teenage mothers. If you've examined them, if you've found all their maternal history from previous pregnancies, and that's how we determine the risk of pregnancy.
So the key thing, first of all, is that don't think that your pregnancy is a safe pregnancy, that you don't have any risks because maybe you're beautiful, because no, my sister, let me just say this thing. I know my people, I know about people, I'm just saying it. Just because you're beautiful, you're fresh, you're young, you pray a lot, your husband said this, and your last friend, when they were pregnant, they didn't have any risk, and they told you now that like, if you do this thing, you're going to be fine. All of these things, basically, the only person who can decide if your pregnancy is high risk or not is at a hospital, or a clinic, which is why you need to make these antenatal visits in the first place, right?
And you need to make them early. So as soon as you know that you're pregnant, it's important to go for your first antenatal visit. We offer a comprehensive service where we have a lab, so we do all the blood tests. We don't deliver, but we do the antenatal care up to a certain point, and then we send them to the various centers to deliver.
Why don't you deliver? Is there a space?
We don't have that facility yet. Because we
are praying for you.
we launched our antenatal clinic at the beginning of the year, so it's still pretty fresh, and we're still you know, just working our way through it. So by the time that they go to these different centers, they have all their bloods, they have everything worked up, they have all their ultrasound scans, and I think that helps a lot because
do you make recommendations, like when you refer them, so when it's time to deliver, do you make recommendations to them like what facility they should go give birth and connect them with like a doctor in another facility? How does it work?
Usually it's the facility that's in your area.
Okay, the closest one. Okay.
The closest facility. Unless they have specific high risk, then we'll send them to certain areas.
Okay.
We also, the thing with pregnancy is that you can recommend a center and then someone will be in the middle of town and now they're in labor. Wherever they go, because pregnant women are supposed to carry their antenatal books everywhere they go.
Okay.
So
the antenatal what?
The booklets.
Okay, booklets.
That have
like your card.
Your card, yes.
Yeah, okay.
So your card that has all your information and all the pregnancy information, so that if you go into labor anywhere and you can't go back home and get it, you know.
What makes it possible for the Well Woman Clinic to stay open during this pandemic? Do you think your advantage is that you have great partners, great donors? Is it the management style? Is it because you're women-led? Say that. What is it that made it possible for you guys to stay open as such a small facility? Because 7 people, that's actually really, really small.
Yeah, it is really small.
It's a really small team. What makes it possible for you to stay open?
I think first of all we do have support from our partners. So,
and who are some of those partners?
On the antenatal clinic side, that is the Ministry of Health and Sanitation, as well as the Heineken Africa Foundation.
Is there anybody at the Ministry of Health who is specifically like an advocate and that's like really an individual? You feel like within the Ministry of Health, this person is for us, like they really support us? Or is it just the institution as a whole?
I think, well, I must give credit to our project manager, Ms. Tina Davis, because she makes sure that everything is done. She knows who to speak to. She knows.
Is this your project manager within your facility?
Within the facility. So
Tina Davis, you need to write down the notes and give it to other facilities.
No, because Tina is on it. She is very demanding and she tries to make sure that we have everything that we need. And I'm not going to say it's without challenges. So there have been times where we might not have enough laboratory reagents. We might not have enough medications, and you know, that kind of thing. You know? And especially now where it's difficult to get stuff in. So with that, we have had to, you know, step in and had to, you know, try and make sure that our pregnant women have everything, because they're not paying for anything and they shouldn't have to pay for anything. So we have that. Then we have our generous donors. We have the hematology and Cancer Untold in the US, and they donate a lot of packs for cancer care, as well as last week we gave packs to our postnatal mothers. They came back for their visits, you know, and we've been following them since the beginning of the year, and now they've had their babies and the mothers are healthy and the babies are healthy, and that's our aim. So we thought, you know, let's try and put together packs to just encourage them and to help them, you know, take care of their babies.
Do you guys give lollipops at your antenatal visits?
We don't, but that is an idea.
My doctor in the US.
That is an idea.
Every antenatal visit, you get a lollipop. And I know it feels like nothing, but it was like, it just felt like that added thing, like a recognition from her and her facility that this sucks. So here's a lollipop.
That
you
is
said you also sweet. Have the Heineken Africa Foundation that supports you?
Yes, so they've supported us for many years. We also have an outreach program where we go to Sussex and Waterloo and we do ultrasounds at clinics there. So we have a mobile ultrasound that goes out and we do the scans, we check for any abnormalities, we check for any risks to pregnancy, we date the pregnancies. So that's also running weekly or bi-weekly. And they've been actually very good, because at first we were a bit afraid that, oh, you know, we're also going into the community. Is it safe going into the community? But we'll get there. They've socially distanced all the patients. All of them have masks. Fantastic. There's hand washing facilities. So we're also able to do that. So it's definitely our partners. And it'll be other donors. Like I spoke about the Mask Up campaign with Azealia, and she donated masks for our cancer patients and our pregnant women. So we have a lot of different partners that don't forget about us.
That's good.
But at the same time, on the other side, our breast cancer side, we provide affordable healthcare. You know, so that isn't free, but we're also trying to make it as affordable as possible. So yeah, we're
Fantastic.
always
Okay.
open and willing for more partners to come aboard
Yay,
because then we can
partners.
help. Yeah, because we
Of
can
course,
help more
of
people.
course, of course.
Because we do have a very limited budget and there is a limited amount of patients that we can take care of. We have the J.V. Jones Foundation and they pay for scans for. Suspected breast cancer
different partners
patients.
take on different responsibilities.
Yes, so
and
they'll
that
say,
allows you
okay,
to
I
make
want to
more.
pay for a few scans
Sure.
for underprivileged people. So we try to make sure that you still receive treatment even if you don't have the money.
So could you give me an idea of like how many patients you see monthly or daily, like what your inflow is and how that's changed with COVID or if it has at all?
Okay, so on the antenatal side, so all the pregnant women, we are sitting on about between 150 to 200 patients a month.
Okay.
There was a stage in March where it really dropped, and that was when
Right, when they announced. Okay,
yes,
okay.
where it really dropped, and then all of a sudden it just went up. And then the breast cancer side, I think we see probably the same number of patients or a little bit more. And then from external clinics that are coming for scans, we'll see anything between 15 to 20 patients a day coming from for scans
That's a
from
lot.
other places. Yeah, we are.
With 7 like
We are
people.
quite busy, and yeah, we are busy. We're busy.
Far be it for me to take up any more of your time because I know that you guys are so busy. You're busy. You're probably writing something, doing something, prescribing something. You probably get a phone call really soon from somebody.
Probably.
But I think that the work you're doing is so important. And hopefully when other clinics, private care providers who may have closed down hear or know that you guys are still open in the way that you've changed your service delivery, perhaps that might inspire them to rethink this decision to shut down because yeah, we need our healthcare providers, all of them. Like we can't spare a single one.
Yeah.
Very important. That was Dr. Lisa Graham from the Well Woman Clinic here in Sierra Leone. And as she's been saying, it's very important that pregnant women access care during this COVID-19 pandemic, because as a pregnant woman, you're not going to know if you have any risks at all or if your pregnancy is a high risk pregnancy. So it's very important for you to continue to see the doctor, for you to continue to go to clinic every single time you have your appointment, because you need it and your baby needs it. The coronavirus is still very real in Sierra Leone and it has made a lot of people sick. We've had over 1,000 cases and over 50 deaths. To continue to protect yourself, make sure you practice social distancing like the doctor was saying. If you don't need for comot, no comot. And if you comot, make sure say you stay away from people that are in close physical contact. Also, not forget say this mask when don't make mandatory way una no they wear. It's very, very important because when you they talk, all man fit to say when they talk, they're not they pit. But just because you know they see the pits, no mean say the pits not they come out. So that pits they we person they talk where they come out. So I go land pan table, land pan domot, land pan and land pan other person and potentially spread the disease. So even when they talk to a person, especially if you're not a pregnant woman, make sure say you wear your mask because pregnant woman your immune system not they work as well as way you not get belly. So especially when you're pregnant, make sure say you wear your face mask. If you're gonna do, and if anybody want to talk to you and not wear face mask, you make sure say you wear your own so you not go expose yourself to the coronavirus. Please take this seriously. If you feel any small sick or you get any question at all and you na woman na this country na for call the Well Woman Clinic then 1080 hotline, doctor then they midwife then they go answer you call. And then for all other sick, any other thing where you feel, even if pregnant, you're not pregnant now, don't remember that the national helpline is 117. If you begin feel small sick, and they talk about this small sick because anytime we talk, but people and they feel say, oh, what do you mean by small sick? But a lot of times now this, all man feels say the small sick where it gets not big enough for you call. The next thing you know, it's coronavirus and it's too late. Then go die on the way to the hospital, then go die in an isolation center instead of they're able to make into treatment center for and save their life. So please, if you're feeling sick during this period, not taken for granted, call 117. Thank you so much for watching The Local Response. See you next time.